Hi, I'm Dr. Prashant. I'm Psychiatrist and Sexual Wellness Expert. I'm co-founder and director at PassionFruit Wellness, Bengaluru and Pune.
Nowadays, people are very curious to know about PEP. PEP means Post-Exposure Prophylaxis. The Post-Exposure Prophylaxis is a group of medicine which is taken after possible HIV infection. So, if you take PEP after that exposure, it may help you to take hold on the HIV virus. So, now when to take PEP medication, the time duration is most important factor here. So, someone has the unprotected sex or someone has sex with unknown person and that is unprotected. So, that is one of the indication where you need to take PEP. Again, as I said, the time duration is very important factor here. So, PEP has to be taken 72 hours within that exposure. So, once you had unprotected sex, and if you feel that you don't know that person's HIV status or you don't know that person's how many people that person is active sexually, you don't know about their partners, so better to reach out doctor, discuss with doctor, and if doctor tells you that you may need this PEP medication, however, it has to be taken within 7 to 2 hours of that exposure. Then who else can take the medication? We see a lot of young generation, the people, they are very actively taking different drugs and they use the same needle to inject these drugs. So then there are chances of transmission of HIV. So someone is into these activities, definitely they can reach out doctors, and if it is advised, they can take PEP. Even all doctors, I mean mainly the surgeons, if while doing surgeries, they get some cuts or something like that, and the person is HIV positive, because nowadays HIV is mandatory to get tested before any surgical procedure, and surgeon knows that the person is HIV positive. Even after taking all the precautions, if there is any cut, so that doctor also should take PEP again within 72 hours. When not to take PEP, because what happens, I get a lot of clients who reaching out doctors, even with known partner also, they don't use condom, and they know that their partner is active only with you only, but since not use condom, so they get panic again and they come to me and they ask me, doctor, should I use PEP, because I know the partner is committed to me, but I'm a little worried because I read a lot of things, so I don't want to have HIV infection, should I take it or not? So again, it depends, the advice can be given based on the discussion happened with the person. But who should not take? For example, as I said, the client they will be so panic after, they lose their focus, concentration, they get very agitated and they reach out clinic and they say, doctor, usually, doctor, yesterday night I went to party, I had some physical contact with the person, but I didn't kiss the person, or I didn't even remove clothes, didn't penetrate, there was no fluid exchange, nothing. Then only touching. So, but that also, creates panic situation in many of my clients. So, after hearing history, so I tell them when to take, when not to take. So, please don't take decision on your own. So, but any question, reach out doctors, and even reach out, because I have seen many people who had unprotected sex, and maybe that was a paid sex, but they don't reach out doctors. After 1 week, that time there is no option. So when not to take, if someone has crossed that 72 hours duration, like it's 3 days, 4 days, so there is no point taking PEP. So always precaution, anytime you have unprotected sex with unknown person, randomly, better to reach out doctor, consult doctor, narrate details, don't hide anything with the doctor, so that then only doctor will be able to give advice whether you should take it or not. Because I have seen a few people, they have received treatment when it is not required. So don't put into risk also, because we have to go according to side effect profile of the drug also. If it is not really required, then it really not required. You don't have to take that and get into some trouble. Yes, that was all about the PEP.